The reason I got involved as a volunteer at the hospital is because my husband had dementia for nearly 8 years. I lost him not quite a year ago. And in the last couple of years, we had a few visits to the hospital, partially for dementia, partially for other conditions, partially for falls. So we found ourselves on Oxy ward quite a few times.
So my role is to engage patients in activities on the ward. So we have a mixture of patients with dementia and delirium. So it's important for them to be kept occupied during the day so they sleep better at night time. It also gives them a sense of purpose during the day to get up.
Some of the challenges we face on Oxy is it is a small ward, and we do have an activities table on the ward which does take up quite a lot of space. We try and get as many of our patients at the table every day, and that can include family members as well as staff supporting the patients to complete those activities.
We have 11 beds in bays and we have one side room currently. It's not particularly dementia friendly. If we was able to transfer our side room into an activities room, this will make a massive impact for our patients. It would give them a separate area off of the ward, less clinical.
Having a separate room on Oxy would be really great for our patients. The ward can be very busy, can be very noisy, and with our older patients, their hearing potentially can be quite difficult in those environments. So having a designated space where it is much quieter and they are able to focus on what our activities coordinator is saying and able to really sort of zone in on that would be really beneficial.
I spent 10 to 12 hours with John. It would be lovely to have been able to go into a room, do some activities, just sit quiet and see my husband as he was, when he's not agitated, when he's not aggressive. It would have been lovely to have more time like that, and I think the side room would have made a difference.
So in terms of refurbishment, there are some really good guidelines on dementia units and specifically sort of colours that are used, making them more visible. On Oxy ward, our bathrooms are very white. Commonly for someone with vision difficulties and a cognitive impairment, it can be quite difficult to identify items.
A space away from the ward where it's more homely, a bit more relaxing and like non-clinical would be really good. It'll be more of a comfortable space and just give us a space to do the activities that we want to do that we can't do currently on the ward.
It's really important that Oxy gets some improvements to the ward, including the activities room, to continue that good work through the consultants, stimulating patients on the ward, combating loneliness and getting people out of hospital quicker.
Without the charity, most of this couldn't happen, and yet with their support, I think there would be less strain on the NHS.
Transforming the ward and the activities room won't be funded by the NHS, so we would be relying on our hospital charity to help us with this.
The care of the NHS is amazing with what they have to use, but people like you donating will mean that people like myself and my husband would have had a calm, peaceful environment to enjoy the last 6 months we had while we were here. It would have made that time even more bearable, enjoyable, and I might have seen just a little bit more of my husband if he'd been in a calmer place.